No chest pain, no cold sweats, no warning. And the culprit. It's not always cholesterol or high blood pressure. Sometimes it's the wrong sleeping position you've unknowingly stuck with for years. Sleep is supposed to be a time of rest, but not for your heart. Your heart works non-stop. At night, if you sleep correctly, that's when your heart finally gets to recover blood pressure, stabilizes, heart rate slows, and regenerative hormones are released. But if you're sleepless night after night or constantly sleep on your back, your heart is forced to fight through repeated oxygen deprivation. This becomes especially dangerous for older adults, particularly those with heart attack early warning signs that haven't been diagnosed. Research shows that heart attack symptoms in men over 60 often strike silently, especially during sleep. And the most tragic part? Most people ignore the warning signs of a heart attack simply because they don't realize that sleep posture could be the final trigger that shuts their heart down. Part 1: Sleep and Heart Health. The overlooked connection. When you fall asleep, a complex series of biological processes begin to unfold inside your body, especially within your cardiovascular system. Many people don't realize this, but your heart never sleeps. This is the time it is programmed to recover if you sleep long enough and the right way. During deep sleep, your heart rate naturally slows and your blood pressure drops. This allows your blood vessels to relax and reduces the pressure on your artery walls. An effect often compared to a free dose of blood pressure medication your body produces every night. In contrast, if you sleep less than 6 hours or frequently wake during the night, your body cannot spend enough time in deep sleep. As a result, cortisol, the stress hormone, stays elevated, making your heart beat faster and driving blood pressure higher through the night. This is one of the silent causes of heart attack that most people never consider. A study published in Nature showed that just one sleepless night significantly reduces your body's ability to clear beta amyloid, a toxic protein linked to both memory loss and cardiovascular disease. Over time, this can raise the risk of both cardiac arrest and heart attack in older adults. Another Harvard study found that people who sleep less than 6 hours per night are twice as likely to suffer a heart attack compared to those who get adequate rest. And particularly concerning heart attack symptoms in women are harder to detect. They often don't involve obvious chest pain, but show up as fatigue or vague chest discomfort. This is why many people miss the early signs and symptoms of heart attack when they wake up feeling tired every morning, carrying the signs of a heart attack right now without realizing it simply because you think your poor sleep is just a part of getting older. Part 2: Dangerous Sleeping Positions for the Heart. After 60, have you ever woken up in the middle of the night feeling breathless, your heart racing, or your whole body exhausted? If the answer is yes, you may have already experienced early warning signs of a heart attack without realizing it. And the silent cause behind these symptoms could very well be your sleeping position each night. For people over 60, sleeping on your back may seem harmless, but it can be surprisingly dangerous. In this position, gravity causes the tongue and soft tissues in your throat to relax and partially block your airway. As a result, you may experience episodes of temporary breathing stoppage, a form of sleep apnea that is common but often undiagnosed in older adults. Each time the body becomes oxygen deprived, the brain sends an immediate alarm signal, releasing adrenaline to wake you and speed up your heart rate. Heart rate spikes, blood pressure rises. If this cycle repeats dozens of times throughout the night, your heart is robbed of the chance to rest and instead must work overtime to compensate. This is one of the most silent causes of heart attack among older adults that many people overlook. Statistics show that the risk of blood pressure and heart attack increases sharply in those with sleep disturbances or poor sleeping posture. Research published in the European Heart Journal revealed that up to 40% of minor heart attacks occur during sleep, and most patients do not wake in time to seek help. This is even more concerning for people over 60, as the body's ability to regulate blood pressure and circulation declines with age. If you often snore loudly, feel tired even after a whole night's sleep, or wake up with a mild headache, these could be signs before a heart attack that you should not ignore. This is especially important if you have a history of high blood pressure, diabetes, high cholesterol, or a family history of heart attack symptoms, male, female. Sleep is meant to be restorative, but if you sleep in the wrong position, it can become an invisible burden on your heart night after night until your heart can no longer bear the strain. Part 3. Protect your heart while you sleep. Here's the good news: you don't need to take extra medications or visit the clinic every week to lower your risk of a heart attack. Simply changing the way you sleep each night can help you naturally and effectively prevent a heart attack. The best sleeping position after 60. On your left side, according to many studies, sleeping on your left side is considered the best position for your heart. When you sleep on your left side, gravity helps blood flow from the lower body back to the heart, reducing pressure on the inferior vena cava, the central vein responsible for returning blood to the heart. This is especially important for older adults whose hearts are already weaker and blood vessels less elastic. Reducing this pressure helps the heart avoid overworking, which stabilizes blood pressure and heart rate throughout the night, providing your heart with a real chance to rest. Sleeping on your left side also helps reduce acid reflux, a common cause of poor sleep in older adults, which can trigger nighttime awakenings that are often mistaken for heart attack symptoms in women, such as chest tightness or difficulty breathing when lying down. How to sleep on your left side comfortably. Place a thin pillow between your knees to keep your hips aligned, which reduces strain on your spine. Use a pillow of moderate height so that your head is neither too high nor too low, which helps avoid neck strain and promotes proper blood flow to the brain. If possible, hug a long body pillow in front of you. This helps maintain the side sleeping position throughout the night and prevents you from rolling onto your back unconsciously. A study from Brazil found that older adults who switched to sleeping on their left side for 4 consecutive weeks showed significant improvement in morning blood pressure readings, a key factor in helping to prevent heart attack after 60. What if you can't sleep on your side? In some cases, people with shoulder issues, cervical spine degeneration, or hip injuries may find it challenging to maintain a side sleeping position. If that's the case, you can still sleep on your back, but there are essential adjustments to keep in mind. Place a thin pillow under your knees to relieve pressure on your lower back and heart. Slightly elevate the head of your bed by about 10 to 15 degrees to support blood circulation and reduce the risk of acid reflux or chest tightness symptoms that can easily be mistaken for heart attack pain. However, if you snore loudly or frequently, wake up gasping for air, sleeping on your back is best avoided. For those at high risk, every oxygen deprivation episode forces the heart to work overtime to compensate. Over time, heart failure signs and symptoms may begin from nights just like this. Improve sleep quality to protect your heart. Sleeping position is just one part of the equation. To protect your heart fully, you should also focus on these factors. Reduce foods high in salt and saturated fat. 2 of the key causes of a heart attack. Avoid eating dinner too late, especially fried foods or sugary dishes. Turn off electronic devices at least 1 hour before bedtime. This allows your brain to naturally produce melatonin. Maintain light physical activity during the day, such as walking for 15 to 30 minutes to promote deeper sleep. Keep your bedroom quiet, calm, and either dimly lit or completely dark. Sleeping properly in the correct position for the right amount of time is one of the simplest ways to address how to prevent heart attack, though few people truly pay attention to it. Especially if you're over 60 and have already experienced symptoms like chest pain, waking up tired, or unusually high morning blood pressure. A good night's sleep may be the best medicine for your heart. Part 4. Common mistakes and a new mindset about sleep. There is a very common and very dangerous belief among older adults. Many say, "I sleep less because I am older. I am used to it." Others think, "It is just a little insomnia. It is no big deal." But this mindset causes thousands of people to overlook the early signs of a heart attack until it is too late. The truth is, poor sleep or waking up tired is not normal. This is especially true if it comes with chest tightness, a racing heart during the night, or shortness of breath while lying on your back. These are not just sleep issues. They can be signs of a heart attack your body is trying to warn you about. In men, heart attack symptoms for men after 60 often do not look like what you see in movies. Not everyone clutches their chest and collapses. Many feel a little dizzy, have a dull ache in the shoulder or neck, or wake up with a vague feeling of unease. Often they think it is due to what they ate or from tossing and turning too much. To remember that what causes a heart attack is not just cholesterol or stress. It can also be years of nightly pressure on your heart without you knowing it. Sleeping in the wrong position, not sleeping enough hours, or missing deep sleep can prevent your heart from recovering. As you age, your heart loses the ability to adapt and withstand stress. Every poor night of sleep and each episode of sleep apnea puts more strain on it. The new mindset for people after 60 is not to tolerate poor sleep. You need to care for your sleep like you would maintain an old engine. Sometimes the difference between life and an untreatable heart attack is just one misplaced pillow. You do not need to wait until your heart sends a loud warning. Many over 60 do not realize heart attack warning signs have been showing up for years. These signs may appear through snoring, waking in the night, or feeling tired in the morning, assuming it is normal aging. Sleep does not just recharge your energy. It gives your heart the chance to heal each night. If you sleep in the wrong position, skip deep sleep, or make your heart work all night, the damage will build. By the time you feel it, it may be too late to undo. Start today. Adjust your sleeping position. Change small habits. Pay attention to the subtle signals your body sends. The way you sleep tonight could decide if you wake up tomorrow. If you found this post helpful, share it with a friend or loved one. You might help them prevent a heart attack without needing a prescription.